Dr. Naima Al-Gassir is truly a woman with a cause. She's a nurse serving as the Assistant Regional Director for the World Health Organization Eastern Mediterranean region and is a WHO representative in Egypt. She's held leadership positions in nursing and healthcare across the globe, from Iraq to Syria and Lebanon, among other locations. Before beginning her work in Egypt, Dr. Al-Gassir served as a WHO representative for Iraq and as a United Nations resident coordinator and humanitarian coordinator in Iraq. She joined the WHO in 1999 as a senior scientist for nursing and midwifery and was responsible for the coordination and integration of nursing and midwifery issues into WHO policy and programs. Prior to her tenure at the WHO, Dr. Al-Gassir was regional advisor at the United Nations and focused on analyses of health in the Middle East. A Bahraini national, she has also worked in that country's Ministry of Health to develop its strategy for healthcare. She received her PhD in nursing sciences from the University of Illinois at Chicago, where she also earned her master's. She earned her bachelor's degree in nursing from the American University of Beirut in Lebanon. She is a fellow of the American Academy of Nursing and brings to us a unique global perspective on healthcare. I'm delighted to welcome to Villanova and the College of Nursing the extraordinary Dr. Naima Al-Gassir.
Yes, good afternoon. And I'm humbled after this presentation and especially hearing extraordinary presentations, speeches, students' experiences since morning. I am more privileged today. I kept thinking and enlisting my blessings. One, I would like to thank Dr. Fitzpatrick for her persistence to make sure that I'm here. She has seen me on different occasions, but she most remembers why, for some reason. But one thing that she has always been persistent about, that she did write to me and I did on the spot. And I kept thinking, how come, what happened? Well, working in difficult conditions, working in emergencies has been, I would say, a slight contribution to lack of, I would say, my communication and networking. When I say blessed, because today I'm in a milestone in my life, I'm very privileged to have accepted to be part of this forum, part of the 60th anniversary of the new village of Villanova, and also at the same time setting the stage for the future. Today we heard many different thinking, how to go about thinking what we were taught, shift in how we want to look at issues. Tomorrow is the 7th of April, World Health Day. It is the birth of the World Health Organization that was established for a cause, that was established for a reason. There are many people in this room who have been one way or another being touched with the World Health Organization. Maybe we are now calling it global health, but maybe we are also seeing it from our own country perspectives, a much more narrow. In this room, there are two key mentors who have affected my life very, I would say, intensively. As a young professional, one of them is Rear Admiral Julia Platonik, whom when I saw her the first time, I was very impressed. Wow, Rear Admiral, right? And then I found, just observing her, how she's mentoring, how she's intervening, how she is really placing nursing within the health system, and how she's seeing nursing beyond giving the care to the sick, beyond waiting for the patients. And I heard today from the students. The second one is Ms. Connie Valerie. She was then the Executive Director for International Council of Nurses. I said I was blessed because I had opportunity to be in the forums and in the situation with great nursing leaders who not only shaped the US nursing, also shaped with their humane, with their care, with their attention to the details of personnel rather than looking at the disease. They affected me and mentored me one way or another. And I have to recall, I have to remember my late advisor, mentor, Dr. Alumni. I don't know how many of you know her. Believe me, every hour I think of her. And I say, she taught me to look at health, at nursing, from human rights, from ethics, from the perspectives of the individuals and families and communities. These are some of my blessings later in my life, but I'm coming also from my early life. WHO, World Health Organization, is the first specialized United Nations agency. And it was right after World War II, trying to reach the most vulnerable people. The United Nations, that brought me to come to it, is actually looking at peace and security and humanity. The World Health Organization was trying to keep people healthy. Now, its member states are the ones who are shaping. I am a secretariat, I'm working for the member states. This distinction is very important because there is a lot has to be done based on the lessons learned and evidence. Health of all people is fundamental to the attainment of peace and security and is dependent upon the fullest cooperation of individuals and states. It's a very powerful statement. How many in this room have thought of health as a fundamental base for peace? Raise your hand. Many few nursing students hear this. How many of us have seen that the health of one individual in the little corner of the world is going to be a public health global security? I served in Iraq in 2006. The first 2 cases of avian flu deaths were in Sarkab. I went to that place in the difficult times. Sarkab, Suleymaniya in the north of Iraq. It created a very high level of security alert to the toppest of the leaders of the world. This was the first time people were looking at the health as a health security. Now health, not taking it from disease, but from our daily behavior. A young woman, 14-year woman, died because she was just trying to prepare food for her family. A chicken that carried the virus. Healthy, beautiful girl. I visited her family and I saw her parents proud. This is where it's linked, our behavior, where it is. So this constitution for me, this has guided me since my childhood. Believe it or not, since 8 years old. I was 8 years old that I started to know what is World Health Organization and what is World Health Day. Wanted to take the challenge. So the nursing students that I was asked to inspire you inspired me today because many of you are already handling these things. Now, attainment of health by all people to the highest possible level is something that all of us strive. Whether we are disabled, whether we are vulnerable, whether we think we are healthy, we think our brains are fully functioning, and we are mentally well, right? Because I have raised to myself, always consciously saying to myself, my mental health is up and down. I need to admit this because this will allow me how to interact and how to interrelate with another human being. A woman or a man, a young man, a child, a disabled, and elderly. So that's a very important, again, constitution aspect that I learned. How can I reach to the highest possible of health? Is health a commodity? This has been questioned in the United States. Health definition as a state of complete physical, mental, and social well-being. This is the constitution of WHO definition of health. And I know in my region, the Middle East, I know ministers of health and some of the Islamic leaders try to push that we add this spirituality. Maybe Connie remembers during the World Health Organization and the resolution trying to add the spirituality to the health definition. It does not mean Islam, it does not mean Christianity, it does not mean Judaism, it does not mean Buddhism, but it means there is a certain belief that we have within ourselves on how we relate to the universe. And that did not happen, but this is something I think we should know. I did take this quote from Dr. Houghton Mahler, whom I was privileged to work with in different times and in different forms. He was being an inspirational. These nursing students, how many of you know Houghton Mahler or his books or what he has done? Please go when you're Googling, I learn from you, and look for Houghton Mahler, and you will know what I'm talking about. Health action should not be imposed from outside, foreign to people. It must be a response of communities to problems they perceive, supported by adequate resources. Today we had excellent presentations of the nursing students, right? Where are you? I saw you. So when you talk today, you mentioned about the community. You talked about the individual, the family, and the community. We learned in the Mother Divine, and Roy, about the self-care. We learned about the care of individuals and families, and this is where core of WHO, one of the Director Generals of WHO has said many years ago. We had heard about governance and stewardship. We say, what is WHO? The Secretariat, what are you doing? There should be somewhere, I don't know what to call it representatively, but there is an intelligence, a generation of intelligence should happen. There should be a research and evidence. As nursing students, how many of us have been told, look at the problem, come up with your nursing care plan based on a problem-solving approach? Right? Now, to me, that was research. And I had to, every day, to fight the physicians in the room, please don't be insulted, to fight with the physicians to tell them we are doing research. This is a research. And to always argue with the academician that this is a research. No, only academicians do research. So we need to think of research and evidence different. And to me, that was important, generation of intelligence. We need to continue to seek, quest, and find out. In order to formulate policies, in order to formulate strategies, how many nurses in this room believe that nurses and midwives should be in formulating health policies and health strategies? Okay, how many of us are working towards it? Okay, so these are some of the things we need to reflect. Where are we, how are we working towards it, and what we do? By the way, when I started my early life, I didn't know what I'm doing. I didn't know that I'm really setting policies. I didn't know. This was to me a work that I have to do. I didn't know that when I'm sitting with the Minister of Health, I'm actually formulating a policy. Okay? But this is something, the learning that we do. Building coalition, and I think, like we said, Dr. very well, the building coalition, building partnership. Today, we are no longer saying that I can do it, I will be the only researcher, and we are the only discipline who can do it. Sorry, we cannot. We have to be working with others. Now, this is something that shocked the ministers of health in the region 2 years ago, 2011, with the Arab Springs. How many of you know about the Arab Spring? Okay. Research is not a luxury that is affordable only in times of plenty, but is a continuing necessity, and never more so than in hard times. Why I use this? Because I was attacked by my colleagues, mainly non-nursing colleagues, mainly medical model, medically oriented. I will not say physician, I will say medically model, medically oriented. You are joking in your role to come now and prepare for us a quest. What is the status of research and research for health in this region? Why we are having 17 countries out of the 23 countries we are serving going through complex emergencies? Did you get my question? I was questioned, what on earth I'm doing? We have disasters, we have emergencies, we have conflict, and Naim Al-Qasir is talking about research for health and is trying to do clinical trial research code of ethics. When I put this for the ministers, it shifted their thinking. I'm talking about 23 ministers. This was October 2011. Presented to them a fact. Clinical trials in our region, in the countries in our region, during these difficult times, during Arab Spring, has risen like this by pharmaceuticals companies from nations outside the region, testing their drugs and machineries and everything in our region during the crisis. Does this warrant that we should look at the hard times or not? Does this warrant that we should look at research in a different way? I wanted to bring this shift that there should be a shift even in nursing education on how we look at research. We should not see it as by a few elect and elite. It should be a different way of thinking and looking at it. So I did have this quote because I believe in it. Quest for knowledge to lead to happiness. Today we talked about love, about care, about reaching out. How many of you are British origin here or British or from United Kingdom? Okay, no one. This current Cameron. Okay, the current Prime Minister, if you remember, he started by saying he wants his agenda is happiness. And everybody laughed around. I remember we laughed. This is talking about. Now there is an index of happiness, which is the happiest nation and which is the not happiest nation. I don't know how many Saudi colleagues, friends, you know the Saudis came, even though they are richest, they are kind of happy. I think it was Nicaragua that they are poor, but they are very happy. So this is, again, brings to us something that we need to look. I have to say, in nursing, whether in Islam or in Florence Nightingale, I would say in Islamic, because we have أكمل يا بنات وينكم؟ Rufayda bint Asad al-Aslamiyya. She was a nurse during the Prophet time that she had done, also evidence-based. She started documenting. Most of us do not know. We know Florence Nightingale. And I wanted to show this, to show a difference, that our humanity, our civilizations, have many common values of care, of evidence, of statistics, of treating each other well, of respecting each other, of respecting the differences. I was just saying around the table that I was asked whether I can opt to not to go to the Mass. And I said, I'm going to the Mass today. But I was sharing one thing. My parents were raised in communities that there were Christians, Buddhists, Jewish, and Muslims. To me, that's a very, it's not necessarily, and maybe atheists, I don't know, maybe. But I know that they have friends. But this brings that we need to look at human being first, before we say, are you Muslim, are you covered, are you not covered? I receive many questions. Do I look the same when I go to Bahrain? I say yes. Actually, I'm much more freer in my country because I feel protected. There are certain places I choose to just put the veil out of respect. Even in Saudi Arabia, my friends from Saudi, I never covered my face, covered my head. Because it's a belief that our face should be seen. This is the core of, again, interaction and relation. This is where the care comes. Nursing, please look at people differently, and already you are taking. But I wanted to put Florence Nightingale bringing the evidence and building the evidence. Now, where is the voyage and link between Bahrain, GCC, Villanova, and Call for the Decent Life? How many of you learned last week the European Union has actually published now a documentary on decent life by 2030? Okay, it's a very interesting. Now they moved from Millennium Development Goals to post-2015 Sustainable Development Goals to decent life for the Europe that they want to shape. My mother is drinking her soup. She visited me for the first time in Cairo last week, but last month. She's an inspirational in my life. My mom is actually someone who taught me to volunteer from day one of my childhood. Today we heard about volunteerism bringing happiness. I saw my parents, how they could support the community. And it was always a community. This was something for nursing. I challenged my whole family to get into nursing. They thought that if I go to medicine would be the best. I got the scholarship for medicine. They wanted me to go into science. I got the scholarship into science. But by the way, it was all outside Bahrain, because then we did not have university. And I insisted to bring them to nursing. My grandfather, great uncles, everybody called me and said they made a family, and they were all upset. If you go into nursing, we will. And I told them, I want to care for people. I want to work with healthy people, because I want to prevent diseases, and I want to educate them how to take. Somebody was talking, the nursing students were talking about promoting health. I want to tell them if they cannot buy this kind of vegetable, what to eat. So it was an education that I wanted, and I knew what I wanted, to be more of health promotion, disease prevention, little bit of sickness, but care of God who goes after. That's something I was again blessed, privileged, to go into a program that it was 50-50. We started not from the fundamental of nursing. We started from assessing community, family, and then individual. I started the first year going to the kindergartens, to schools, to the factories. This is a little country called Bahrain. It was the time that the primary health care was cooking. And I was a nursing student, associate degree, that my minister then decided I should be on the national committee trying to actually prepare for the primary health care before Alumni 1978. So this is the privilege and blessed I'm saying, but it was looking at nursing and health in a different population. I had this beautiful photo from Oman. You have 200, this is what the link between the, as I said, between the Villanova, Bahrain, GCC. I was fortunate to be the first woman to speak to the 6 ministers of the Gulf state, who in 18 years of twice a year meeting never had a woman from the citizen from the region speaking to them. And in that, I want to tell the nursing students, today we heard from the keynote speaker, be prepared, do your homework, study well, think of whom we are going to be in the room with. These are all the elements that we need to learn. And I have to say, in that year, in 1991 end, when the ministers saw me in Geneva, part of Bahrain delegation, they were questioning. In 1992, requested I be their advisor, and I insisted when addressing them that please give us a chance. By the way, I need to tell you this story because I said it last night. I'm the second PhD holder in the 6 Gulf states. So when they were trying to do a situation analysis and a strategy for nursing and midwifery in the Gulf countries, they had already communicated with Americans, British, AUB, AY. So I went into the 6 ministers. I said, can I have a request? Can you please give us 6 months only to the citizens, to the nursing in the 6 Gulf countries? If we did not get a job, then bring all the consultants. And everybody thought, with this risk I'm taking, I'm crazy. There was no single woman or man in Oman with a BS in nursing. Dr. Sharifa, Mr. Hamoud al-Kharansi, and I can go on and on. They were diploma. There was no single nurse or man or woman in UAE with a PhD or a master, except one Bahraini who was a BS graduate who became UAE national. Same, I can go on and on. Saudi, they were starting few master degree, but they were students. And then we had Kuwait, only 2 master degree, no BSc. Today, after almost less than 20 years, you see where is the Bahrain and GCC and Villanova. I'm very pleased to see graduates. I've met many of them. They are phenomenal, the ones who are in Oman. This was 1992. 1993, I see that already Minister of Health in Oman started to actually do. This photo is my family, extended family. This is actually 7 sisters and brothers and children and housewives. But I wanted to show that as nursing, we bring a care and caring, and we can actually mobilize the whole family. I put always my family because they have been a support to my cause after resisting and not going into nursing. Suddenly my grandfather says to my cousins, you should cut a bit. And my uncles who were not talking to me for a while, they were everyone proud. Person is starting to whisper proud to them. So the change happened from no, don't go into nursing, it's a bad image for nursing, to where I realized in order to shift the nursing, I need to be very strong. I had the first encounter, my first clinical day in the hospital, when I was called by a physician saying, student nurse, bring me coffee. I looked at him like this, and I said, I'm sorry, I'm here not to serve patients. He got mad. He goes to call, the British nursing officer, whatever. They called the head of the school, and they came and I said, yes, I'm here to serve the patient. They had never heard of some assertive person telling them that statement. That made the whole, that made a whole movement. But I learned one thing. I learned that we need to be assertive, and I needed to know where is the problem. Why we are not looked at properly. Why it's undermined for somebody who's serving day and night. And I found out that the messages, the rumors are going, there's a mix-up. Then in Bahrain we had 4 categories of nursing, somebody from three years primary school up to a PhD. By the way, there was no PhD, but when I was interviewed for the nursing school, for an associate degree, I was asked what I want to be next. I told them I want to have a PhD in nursing. Everybody laughed. There were 5 interviewers on that panel. The 5 interviewers, 3 were physicians. And they said, there is no doctorate in nursing. And I told them, there would be. By the way, what I didn't know, there was no Googling, no internet, no fax. So I learned later. But these are some of the things that you need to do. Why I put the picture here, this is, to me, it's Egypt where I'm staying, but I learned from Egypt that usually we read, but we really do not understand. And I have a statement learned from one of my mentors, that when we say one word, it does not mean the same language does not mean the same meaning, does not have the same understanding. And in Egypt, this civilization, fascinating for me that many Egyptians did not know even, the level of the documentation of the care that has been written. And the level of the documentation on this picture, you would see that everything they did, they documented. How they behaved, how they ate, how they healthy, how they were running, how they were harvesting. Again, healthy lifestyle comes to my mind. Now I have to show you this picture in the middle with all the mobile phones. Believe it or not, these are all the mobile phones of my mom. My mother, she has 50, we created for her a directory, international directory. Why? Because I put the mobile phone for a reason. She is now starting to use a smart TV. How many of us have a smart TV? I don't know how to use it yet. But she is teaching me. Between the youngest nephew, 3.5 years old, and my mother, I'm learning from them once I go to Bahrain. Because I wanted to show the shift again in thinking and education. Someone would never believe that she knows about I always say she could have been a Nobel Prize engineer, but the way she is really actually learning. So I wanted to show my mom because I want to show that in the countries in our region, we should not forget that people are learning and they want to learn. And there was the young man, Mr. Barrow, who presented that we should be open and listen, they will learn. But we should not say, okay, they are too old, let's go to the younger one. So this is between the generation and generation. I forgot the generation. Okay, now this young man, maybe you see his t-shirt says Villanova. Guess what? You said about something about the star and the lining. Okay? Now, this young man, I go to, the weekend before I come to here, I go and visit my family. I had to be out of my Egypt and my job. Middle of the night, believe it or not, 4 o'clock, I said I'll go and be with my mom. Thursday, 3 days. On my way back, there's a young man sitting next to me, very gentle, and I asked him, are you going to Egypt for the first time? Where are you coming from? Dubai? Oh, okay, that's nice. And then say, what do you do? I'm a graduate from civil engineering from Villanova University. 2012, I've taken a 1 year off, and now I'm trying to understand the globe. So I tell them I'm going to Villanova and nursing. And, oh, yes, I have friends there. I think one of them is speaking today, Lisa or Elizabeth. It's a little bit here. Who knows? Spencer, Stephen. See, I know his name. Now, before talking about nursing, I was telling them how it's important that we work together. And then I wanted to show the determinants of health. I will not go over this because we have already talked about it. But with the young man, I was saying to him how I have worked with engineering, and he was appalled. How come, I mean, impressed, or how come I know all this about engineers and how many sections they have? Julia Platonic knows, because I worked with, I don't know, 50 engineers of structure, civil, architect, electrical, mechanical, to do actually rehabilitation of Iraq. And that's something this young man told me, yes, we work with the nursing students. Do they work with you? Yes, in Villanova we are having. So I was saying how important it is for them to work together. Now I will not go over this because today it was eloquently done on the causes of ill health. We heard a lot about environmental health hazards, so I will not go over them. But I have to go back to the global health security and humanitarian context in the contemporary world. Today, each one of us in our little corner will affect other person and other family, another country. Today, we are having many emergencies. 46% of the population are living in emergencies and conflicts of the population. In my region, actually majority. Okay? So how are we handling this? Are we thinking differently? Are we educating differently? Are we shifting from the one way, don't be insulted with me, Anglo-Saxon thinking and philosophy and theory that has to be standardized around the world? Is it time to shift? Is it time to shift to see how we can actually build on each other's positive thinking? And this is something I wanted to bring. Today we heard about the effect. I will just talk about poverty, for example. I was struck to see in Egypt, because I come from the same region, but I have to say I learned it new, 40% of the population are illiterate. Majority of the population are under poverty. 75% are paying out of their pockets for health care. 75%. This is one country I'm talking about. Just imagine the others. And Egypt is a very rich, very big country, and a lot has been invested. What's happening there? How can we look differently? How can we look in terms of how we invest? And this is something that I thought we want. There is man-made disaster with the conflicts, but also we have the natural disasters that we are going. What's happening with the globalization? Today we heard about the industry, the pharmaceuticals, medical technology. That's going to be the second industry. Where is the World Health Organization role? When the avian flu happened, the world came together. The WHO played a role where the actually Tamiflu was allowed to be taken and generated so people can have access. So that's where the role of the Secretariat will come. That's where the role of the evidence will come. We heard today about climate change, but again, I didn't want to remove this slide because I thought you would like it. Why treat people, then send them back to the conditions that made them sick? Why? Because if I am giving them the medicine and everything, and then I'm sending them back to their garbage that we show, so what are we doing? And that's again, the regrets of the patients come. Complex emergencies, I have worked in all these countries, by the way. Afghanistan, Lebanon, Iraq, Sudan, Palestinian Authority, that was my first after Yemen, when I joined the WHO UNFPA. Somalia. Now, Sudan is two, I have been working in both. So we are talking about migration, people displaced within home, outside home. Maybe people took Iraq as the biggest, right? Today, we have Libya, we have Egypt, we have Syria, which is still, after 2 years, is still going on very bad. What's happening to the nursing education? What's happening to health professional education? Do we need to have 7 years a physician to be finished in order to do the service? That's the model is being now running in my region. Imagine 17 countries are out of 23 in emergencies, and we are insisting to put the standards of 7 years of basic medical, and then 5 years of basic nursing, BSc, and. Can we think differently? Can we deliver differently? By the way, I am against of poor knowledge and skills. I'm against it. I need to make sure this very much. We managed with my colleague, with my friend Victoria Fariba, to actually shift the thinking of our government, not to have too many layers, and we have 2 layers with evidence, with building the research, with writing. Natural disasters, Iran, Pakistan, Djibouti, Yemen, Morocco. Natural disasters happened in 2011, 2012, beside there, for example, in Yemen uprising that we have. This is all Arab Spring. Emergencies and conflict. I said 49%. I have to correct 46. 49% in complex emergencies. 24% of population in acute emergencies. What are we doing? I was asked a question, why should I think I should work? Are we prepared as nurses? I know you had Sandy and Katarina, how much prepared the programs were. Do we think of scenario settings? Do we think of different? Do we know how to handle people who have lost all their livelihoods? Do we know how to handle suddenly with rush of emergency? When I predicted that we will have some change, Egypt, I only predicted Yemen. By the way, I predicted Oman. This was November 2010, November 2010. In a management of 10 people, I was laughed at. I was the only nurse, all physicians, medical model, again I want to say, and I was laughed at that stop and get shifting and get out of your thinking from emergency of Iraq. I was actually built on evidence that we are expecting a major change in Egypt. There is going to be some turmoil, and this was based on evidence I had dropped into economics, the vulnerability, what's happening in the youth. So, my background as a nurse, as a carer, as a provider, health as a bridge for peace is something that we can play. You want to call me a nurse, you want to call me a humanitarian, you want to call me whatever, but there are basic principles that we want to learn. In my region, 1/3 of the population of the region are adolescents. They are the future. The best picture is actually Tahrir Square when they stepped down, Moriarty stepped down. But today, Tahrir Square is different. So that's again, how can we balance between the youth energy, their wants, their wishes, their vision, and the old people like us. By the way, I color my hair, I tell everybody. Okay? So this is something again, how can we balance? How can we bring the human rights aspect? How can we bring the ethics of relations? These days I'm a lot into ethics. Ethics of relations, ethics of management, ethics of handling each other. Looking at the way I want to be treated as a human being. These are some of the things that I believe strongly, we as the majority of nursing, part of the healthcare system, we can bring the change. I believe we are the change agents. There are others, like you, as Dr. Louis, because he is a major friend, a change agent. We need to see how can we actually capitalize on this thinking and on these values to move forward. Now, this is my favorite Captain Banner in the middle. I was very proud to have this picture with him again in 2008. But it talks about people's expectation, and I heard it today. We talk about people-centered, not patient-centered, people-centered. And care does not mean curative care here. That's something I learned very young as a nurse, or before I became a nurse. I'm not talking about curative care. I'm not talking about hospital. I'm talking about real care, like for each other. Now, protection of the health and the families, and also health equity. Today we hear a lot about health equity, but what does it mean? Do we really study it? Social inclusion, what does it mean? Solidarity, what does it mean? And more importantly, when we say now we have this repackaging of primary healthcare, by the way, I'm a believer in primary healthcare philosophy, approach, and then operational. And I am proud to say that I have done it. Not only theory, but I have actually practiced it. I was one of the 5 members to be elected by my government to do the first 5-year strategy for health in Bahrain. And that was immediately, we said, look at health gains. And health gains was not an investment in health. It did not mean to us investing money. It was meant, how can we take care of the school children and feed them well, which UK did 3 years ago, back again. I don't know how much you are following. Now United Kingdom, in some areas, they have started to feed the children healthy food. I would say this was what we were doing, and we were told to stop by advisors coming to us from the Western countries. Okay? And that's what I'm trying to say. Investment in health, I mean in terms of really investing in healthy environment, housing, right transportation, clean air, clean water, these are safe food, And I do agree with you, food safety is a big issue now, and this is something we have to look at. Now more than ever, the primary health care, there is a very famous document for students who would like to read on universal health coverage. How can you have a balance between enriching the maximum of people to deliver? A lot of work needs to be done. One of your faculty or one of your alumni asked earlier, so this is a research for nursing to do. We should not wait others to tell us what to do. I'm talking about reference to the United States. Migration is compounding, but also I'm thinking of migration of the health professionals. How are we treating them? How are we embracing them? And how are we taking care of them? There is an ethical recruitment guidelines by the World Health Organizations. Member states have agreed on it, and still it's not implemented. How can we do that? I will not go into Millennium Development Goals, not go much into the NCDs. I removed most of the things, but I thought the non-communicable diseases is now the shifting of the healthcare services and systems we heard in the morning has to happen. All our health services have been built on people get sick, few days admission, go home, MRGs, Medicare, Medicaid, finish. Now we are talking about a majority of the population will be sick or live with sickness for a long time, and the more they don't get services, the more their health consequences will have, and then we have to pay more for them. So this is something that I thought that we should put in our attention. By the way, myself, I don't smoke, I don't drink alcohol, because alcohol is another, abuse of alcohol use is another compounding factor. I eat healthy, no salt, not much of sugar. One thing that I didn't do in my professional life, as a health professional, I did not manage my sleep. And you remember, I used to sleep 3 hours, but I will tell you, out of conviction, I can save lives. How can I sleep? I can save lives. I was working around the clock. Admiral Julia Plotnick will remember, I used to have for 2 years only half days off weekend, only Friday mornings. Afternoon was back to work. So what I did, I now at the stage, I am a person with hypertension. Okay? And tomorrow is the World Health Day on hypertension, where 40% of the population are suffering. Today we heard about check. Please check your hypertension, check your nutrition, check your exercise. So, individual rights, our responsibilities and obligations. I come from a background, my great-grandfather and mother taught us to have our rights, but they taught us also to be responsible. And we cannot just ask for rights without responsibilities. When I talked about Arab Spring, now we are talking about rights, but I'm not saying I'm responsible. My right to health care, my rights to the physician, my rights, but I'm not talking about my rights at the same time, but I'm responsible to be healthy, to do exercise, to take right nutrition, not to smoke, and at the same time not invade pollute others people's air. My obligation towards myself and towards my society, that's something moves from individual to collective. This is something I really hope that Villanova takes over. By College of Nursing, by university, I want to say university and a larger community, it's not only nursing. That we need to say now, under health diplomacy, that our rights are actually coming together. It's no longer the rights of Bahrain government versus the rights of the USA. Health is becoming as a health bridge for peace, health becoming as a diplomacy. The rights of one pharmaceutical industry to have medicine developed cannot deny that the people cannot have access. So where are the shared rights? Where are the shared responsibilities and the same communities? This little boy is actually my youngest nephew. But I will tell you why I put him. Do you believe he is now a regular member of a gym for kids? And he loves it? And I was just surprised. It is an extracurricular activity by his school. It was, for me, it was attractive. It's not a gym of weight, but I mean, he is so cute and says, I'm not going to gym. So I'm thinking, oh my God, this little boy is going to gym. I thought he's joking. I thought he's imitating his father. Actually, no, he is going a regular, and he is actually more happy when he is going to his gym. This is where his gym, I think that day he is running. So I like him. Now, the healthy food is for my eldest nephew, who just got married, who is not taking care of his gym. He used to. He stopped since he got married. He's gaining weight. And now all the family is, my mother is insisting that he goes with them on his lunch box, which is unusual for Bahrainis. But trying to say that we are having something to do about your nutrition. Since I read the background of our keynote, but because also I'm working in this area on road safety in Egypt and transportation safety, if you see this little photo here, there is a young woman, a university student, who is actually asking this another woman to carry her things from one side of the train to the other. And when I took the picture and I went to speak to them, they were Egyptian, they were very upset at me. But 2 days ago in New York, I saw this message in the metro that says, drop something, leave it, and it talks about 55, I don't know, people dying every day just in New York because of the way they are trying to pick something. So to me, road safety, the transportation safety, these are something, again, comes to health that we need to look at. In investing in health, very minimum, I'm talking about broader health, we can actually bring more peace, we can actually bring more happiness, we can actually reduce suffering, and we can have more safe lives. Now, I think I'm done, right? Okay, finally, no one speaks anything. Are you tired? Okay, international health regulation is a binding. I talked about the relationship. Today, there was E. coli in Europe. Everybody becomes alert. Egypt's import will stop because during the food chain, they said the seed that was brought from Egypt might have been the cause. And actually, it had to be involved because it was a health issue. So this is a binding document, very powerful. I would like the nursing students, please read it. Please read it. It's a different thinking. It's a different approach on approaching public health. Now, I will not go into the nursing, but I think I want to go to the principles of the nursing strategic directions, where all of you had part of it. The partnerships, the relevance, ownership, and ethical action. Ethical action is accountability. How can we be accountable for what we do? In the nursing, we do a lot. We are more accountable, actually, we are killing ourselves. But at the same time, make the institutions accountable and be aware of what's going on. Now, I was one of the privileged also to receive the same award on behalf of my organization, but 2 days ago, mobile phone turns 40. This is Martin Cooper, who was the mobile phone inventor. And I was with him, receiving with our Director General, the Prince Albert Award from Spain. This is the second, it's like Nobel Prize. And he was there, and he was talking how it has changed his life and the life. And 2 days ago, I read in the newspaper that it is now 40 years. What it has done, mobile phone, in just the last 2 years, and where is the traditional books, and how can we have the social media changing our life? Accountability framework, way forward, I have already said it, but this is a quote, this is my last slide. This is a quote that I use. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Margaret Mead has affected my life, and as I started with Beverly McElmurray, she has the one who has taught me this, and this is something that we do. So please enjoy the 60th anniversary, and your 75th anniversary will find a completely new generation of health care providers. Thank you.